Welcome to everybody here in the room and everybody on Zoom. And it's really my pleasure today to introduce Paul Reeping. Paul Reeping is currently a postdoctoral fellow working in the Violence Prevention Research Program at the University of California at Davis. Although he's never been there, he's just remained in New York. He's one of ours. He received his PhD here in epidemiology and his MS from the Harvard School of Public Health, that place. But his PhD work here was exceptional. And I have to say, he was in my class, which many PhD students know, and in fact, all of them know it. And he did spectacularly. He was like really one of the star students in the class, which involved learning a great deal of information every week and writing about it. Anyway, Dr. Reeping's research is really on the causes and consequences of gun violence, including interpersonal shootings, school shootings, and mass shootings, and active shootings. I have to say, one of my first introductions to Paul was at the New York City Epidemiology Forum many years ago, where he was one of 2 or 3 students chosen based on his abstract to give a talk. And I remember sitting there being absolutely wowed and emailing Charlie, saying, wow, this one is really great, and congratulations on having him as your student. So I'm really looking forward to the talk today, and I'm going to turn it over to you.
Thank you, Pam, for such a wonderful introduction. I first want to say it's just so wonderful to be back here at the university at Mailman, being in front of so many familiar faces and some new, and many people that I've collaborated with for quite many years now. It's also just such a privilege to be here. I am the first of my family to go to college, let alone go and get a master's and go and get a PhD. So then to also be here to be giving a talk is just sort of like a dream that I never thought could be possible. So it's just really, really nice to be here. So as Pam mentioned, my name is Paul Reeping. I'm a postdoctoral fellow. The title of my talk today is Pioneering Preventive Solutions in Gun Violence Epidemiology. So for the agenda, today I will be speaking about the unique position that gun violence epidemiology holds as a field, how gun violence epidemiologists often have to be pioneers in data and descriptive work, study design, and prevention. The reasons for this should be made clear by the end of this presentation. I will also be talking about not only my past, present, and future in this field, but also a bit about the history of the field itself. I hope to convince you by the end that gun violence epidemiology is entering a new phase. Heck, we even have a new conference now, headed by Sonali Rajan in the room. And I hope to convince you that it is now the time to invest in gun violence epidemiology. With increasing levels of funding combined with our craftiness and creativity, we are positioned to accelerate some fantastic work being done here at UC Davis and elsewhere, and really to make real change in the world. This is me running towards my future and little guy. So I'll start with just a quick background. Some of this you might know, but in 2022, more than 48,000 people lost their lives to firearms, including 27,000 to suicide and nearly 20,000 to homicide. This magnitude of firearm death is a uniquely American problem. Among other high-income countries, the United States far exceeds its peers. The United States has 4 times as much firearm death as the next highest country, Finland, and 53 times as much as firearm death as the UK, a country that the US is often compared to. And unfortunately, except for a little dip in the last year, which shows some progress, firearm deaths are increasing, both homicides and suicides, to the point that levels are about as high as they've ever been since about the 1970s. This increase also means that firearms are now the #1 leading cause of death for American children and teens, surpassing motor vehicle accidents. This is a tragic truth that deserves, in my opinion, immediate attention, funding, research, and interventions. So you might be wondering how we even got here. And while there are many reasons, some of which I'll go over today, one reason requires a very short history lesson. In 1993, a paper was published in the New England Journal of Medicine titled "Gun Ownership as a Risk Factor for Homicide in the Home." It found that keeping a firearm in the home was associated with an increased odds of homicide. Households with a firearm were nearly 3 times as likely to experience a homicide than households that did not have a firearm. And nearly all of the risks involved with the homicide was by a family member or an intimate acquaintance. Critics of the study and similar research argued that such findings were being utilized to promote gun control, a stance they believed was beyond the purview of the CDC's mission to conduct neutral scientific research. This also made the gun lobby unhappy, and added to the omnibus federal spending bill of 1997 was the Dickey Amendment, which states that none of the funds made available for injury prevention and control at the Centers for Disease Control and Prevention may be used to advocate or promote gun control. This had a chilling effect on the gun violence prevention community. And just to put in perspective how long the Dickey Amendment has stifled gun violence research, here is a photo of me in 1997. I was only 7 years old when this was put in. The freeze on all federal funds for firearm research resulted in gun violence falling far behind other diseases and afflictions with similar mortality rates in terms of funding. And not surprisingly, publications on the topic also fell far behind what would be expected. These two graphs from a 2017 study show just how much of an outlier gun violence research became compared to other fields. This also led to a lack of trainees. Dr. Sandro Galea and Charlie Brandes wrote this manuscript in AJPH describing the priorities in recovering a lost generation of firearms research. Many students, and myself included, were being discouraged from pursuing gun violence early on in their careers because they were told that there might not be any funding in it and that there was therefore no academic jobs. I know I was told this literally as a master's student. So a fair question is how I or anyone actually ended up in this work. So how did I end up interested in gun violence epidemiology? So after college, I became a 10th grade environmental science teacher at Epic Academy, a high school on the south side of Chicago. This slide shows a picture of the school and my old advisory group. Many of the students I still have contact with today, and they're now in like their late 20s, which is like, whoa, I'm getting old. So gun violence was an everyday reality for these students. While inside the school was extremely safe, most students had to walk to school, and the neighborhood experienced high rates of gun violence, especially compared to a place like here in Washington Heights. Nearly all of my students had stories about how gun violence affected them and their families. And unfortunately, several students were even shot while I was a teacher there, and 3 of my students were killed due to gun violence in my 3 years there, Alex, Deontay, and Mark. One thing that I realized as a teacher was how unfair it was for my students to have to worry every day about gun violence. I also quickly understood that for these students to be able to live up to their fullest capabilities, they deserve to live and go to school in neighborhoods, in the very least, that were free of gun violence. This led me to a journey toward gun violence prevention and public health. So I left Epic Academy in 2015, and I went to the Harvard T.H. Chan School of Public Health to get my MS in epidemiology. Unsurprisingly, there was no gun violence concentration there. And due to my undergraduate degree in epidemiology, I actually concentrated in infectious disease epidemiology. But my focus was still on gun violence. I navigated, or perhaps pioneered, a word that you're probably going to get tired with by the end of this presentation, around the system a bit. And my master's thesis looked into using SEIR models, basically mathematical models used in infectious disease, to model gun violence. And as mentioned prior, while applying for PhD programs, somebody very well known in the gun violence prevention community told me not to include gun violence in my cover letters, and rather just talk about violence very generally. At this point, I decided that the only thing I wanted to do my PhD in was gun violence epidemiology. So I did not listen to him, and I very blatantly wrote that I wanted to study gun violence prevention. Luckily, Columbia, along with a few other schools, accepted me, so thank you. My primary motivation for going into gun violence prevention epidemiology was based on my experience with my students. However, I just want to point out and highlight a few additional events that were unfolding in the United States during the same time. In my first year of teaching, the devastating Sandy Hook Elementary School shooting took place, making a significant moment in the United States call for enhanced gun violence prevention measures. Concurrently, that same year witnessed the Aurora movie theater mass shooting in Colorado, further emphasizing the urgency of addressing this issue. And here on the slide, you can see the memorials that were set up since these shootings. And during my time as a master's student, the landscape of gun violence in the United States continued to evolve with several significant events. Notably, in 2016, the Pulse nightclub mass shooting unfolded, deeply resonating with me personally as a member of the LGBTQ+ community. This tragedy underscored the intersecting vulnerabilities faced by marginalized groups. Following this, in 2017, the Las Vegas Music Festival shooting occurred, marking a harrowing record as the deadliest mass shooting in American history, with 60 lives lost and over 400 individuals wounded. These events, each devastating in their own right, further solidified my want to continue to study gun violence prevention efforts. So, by the time I began my journey at Columbia University, the discourse around mass and school shootings had already permeated the collective consciousness, including my own. The American public was increasingly concerned about mass shootings, and they rated it as one of the most important issues, reflecting a growing concern across the nation. However, the aforementioned historical shortfall in funding, consequently research, meant that we were still grappling with some of the most basic unanswered questions. The underlying factors associated with mass shootings remain largely unknown, a direct result of scarce data sources and research efforts. The gap in this knowledge leads us to the first major segment of my presentation today, pioneering in data and description. Also, these images are from ChatGPT, typed in pioneering in data and description epidemiology, and this is what it spits out. I thought it was cool looking. So, one of the first projects I undertook at Columbia aimed to understand this very void. We embarked on a study exploring the relationship between state gun laws, gun ownership rates, and mass shootings in the United States. Until this point, the intricate dynamics between these factors had not been systematically analyzed, despite widespread speculation and some assertions suggesting that regions with stricter gun laws experience more mass shootings compared with areas with more lenient regulations. I will say that, as we know, this is a denominator problem. There are just more people that live in places and cities and whatnot. So it may appear at first that there are more mass shootings in these places, but per capita, you'll see that is not true. We found that states with more permissive gun laws and greater gun ownership had higher rates of mass shootings. We also found that in the time period of the study, there appeared to be a growing divide between restrictive states and permissive states in terms of number of mass shootings occurring, with permissive states having a higher rate in more recent years. On the slide is a graphic created for us by the BMJ, who published this article. Specifically, we found that after adjusting for demographic variables, that a 10-unit increase in state permissiveness was associated with an 11.5% higher mass shooting rate. Despite being a rather simple and sort of descriptive study, it was the first of its kind and still probably the most influential paper that I've written. The presidential nominee at the time, Kamala Harris, even posted about it on her Facebook, and it has been quoted even till today in articles by Newsweek, Vox, CNN, the New York Times, and many more. Later questions rose about school shootings. Were they different than the broad category of mass shootings? As a result, we also were the first to write an article titled State Firearm Laws, Gun Ownership, and K-12 Shootings, Implications for School Safety, to figure out this question. At the surface, though, let me go back. We found that both school shootings, incidents of a firearm being shot on school grounds, and active school shootings where somebody purposely fired a firearm in a school with an intent to kill or injure many, followed the same pattern in relation to permissiveness of a state guns law and a state's level of firearm ownership. The Journal of School Violence published this work, and this slide shows the exact associations. You can see that some of the magnitudes were quite large, especially the association between increased firearm ownership and the higher rates of school and active school shootings. So again, at the surface, these studies may look simple associational studies. We are adjusting for confounders and whatnot. But I just want to state that gun violence epidemiologists have been having to pioneer new and innovative ways to answer questions, since the government and data sources aren't always in our corner. For example, it's forbidden in the United States to have anything close to a registry of firearm owners. So we are unable to have true measures of gun ownership in the United States. People are also not so willing to report their firearm ownership to surveys, as you can imagine. So gun violence epidemiologists have gotten crafty. For example, my predecessors realized that the proportion of suicide with a firearm over total suicides was a very close proxy for firearm ownership, which is what we ended up using in these studies. Even getting a measure of state firearm laws is much harder than one would imagine. While different scales exist, there's often pushback based on the source of the scale. For this reason, we had to use a unique data source, a traveler's guide for firearm owners, as it was written by an NRA member and gun rights activists. We used this creative exposure so that gun rights activists could not state that we were being biased. Notably, and sort of funnily, we then got pushback on using the scale from others actually in the field. So I later wrote a paper on validating 7 different firearm permissiveness scales, later published in Injury Epidemiology. And finally, even the outcome of these studies, mass shootings and school shootings, are not systematically collected. I had to extract mass shootings from raw data from the CDC, and for the school shooting study, Dr. Claravis and Dr. Rajan created an entire new database through a lot of sweat, work, and effort. So while these may seem like basic studies, they required a lot of ingenuity. Gun violence epidemiologists and their friends are forced to be innovative, creative, and pioneers to be able to move the field forward. And you will see this creativity, especially involving data and the rest of the studies as we move forward. And one last example, which I actually just added recently, I more recently led a descriptive study on firearm deaths in rural versus urban counties in the United States. This was an updated version of a paper written a few decades ago. So unlike in previous decades where there was no statistically significant difference between urban and rural counties in terms of firearm deaths, we found that between 2010 and 2020 and between 2000 and 2010, rural counties had higher rates of firearm deaths than urban counties. On the slide, you can see the main figure from the paper with the self-evident trend that as a place becomes more rural, the total number of firearm deaths increase. Again, a very simple study, but was creative with data sources. I wasn't going to originally include this in the presentation, but I actually just got an email, I think a day or two ago, from one of the co-authors who stated that it was the #1 research output from JAMA surgery for a similar age. In other words, there are still so many gaps in gun violence epidemiology that need to be explored. And practitioners and the public are pining for this work. They want to see this work and they want it to be done. Okay, so for the next section of this presentation, I'm going to be talking about pioneering in study design. I think that study design is a very unique issue in gun violence epidemiology. Often, we are not even dealing with people or individuals, but instead places, businesses, or geospatial locations. And study designs need to be modified to adapt to these differences. But before we dive right into that, let's talk a little bit about the motivation behind the actual study. So after I published the mass shooting and school shooting papers, Breitbart decided to write an article about how our study was flawed and horrible, and for all these reasons that are totally made up and nitpicking a few lines out of context. It was truly an honor. It really feels like you made it when Breitbart comes and attacks you. And also the NRA sent an entire email to their members about this work, refuting this work, which is pretty exciting. So the comments to the article, though, literally gave me the idea for my dissertation. I feel like some people think I'm being exaggerating about this, but the comments from the article, which they're saying never read the comments from a news article about your work, they actually gave me the idea for my dissertation. As you can see here, from the comments on the Breitbart article, they were really concerned about the fact that the study didn't include gun-free zones. They believe that gun-free zones are the cause of mass or active shootings, and they believe this because they think that gun-free zones removes the ability of individuals to protect themselves from a shooting. So you can see here literally like strange that the study didn't include gun-free zones. The more useful statistic might be how many mass shootings happen in gun-free zones. And let's look at the gun-free zones first, idiots. So that's what I did. So they see gun-free zones as the target, or that people inside the zone are sitting ducks, since there's no presumed way for those inside the zone to defend themselves. But it's not just the gun rights activists who are telegraphing this information, and I want to make this clear. The mainstream media has also written articles that stated that gun-free zones might be inviting mass or active shooters. Even the BBC. The BBC, for example, released an article titled "Gun-Free Zones Are a Soft Target," literally the day after Sandy Hook. It's not surprising then to learn that the majority of Americans think that gun-free zones actually make places less safe, not more safe. And unfortunately, up until my dissertation, no study had ever looked at the effect that gun-free zones had on any gun-related outcome. And frankly, no one had even published on gun-free zones because they are very hard to study. What would the study design even look like? It's like a gun-free zone is like a place in an area. As you can see, it's not even that all studies on the topic were inconclusive, just none had even ever been conducted, leaving a huge gap in the literature, especially for such a controversial topic.
Are you taking questions at the end? Or?
Yes, at the end. Yeah, thank you. So what really makes studying gun-free zones so difficult? Well, among other things, it's very difficult finding appropriate comparison groups. What is the opposite or counterfactual of a gun-free establishment, just gun allowing? It's also difficult to accurately adjust for confounders. For example, there may be many confounders that are a cause of a place becoming gun-free and a cause of increased violence. Research also has to consider the spatial components of gun-free zones. They exist in the real world and have geographic boundaries in a way that we don't usually think or don't always think about in epidemiology. Furthermore, even getting appropriate exposure data can be difficult. How do you confirm that places are actually gun-free? And finally, as mentioned prior, there is no universally regarded database for shootings, active shootings, or crime. This often needs to be pieced together. For all these reasons, some scholars told me that they thought it was impossible to quantitatively study the impact of gun-free zones. But I am nothing but stubborn. So I dove into it for my dissertation, hoping to pioneer a bit in the world of study design to finally answer the question regarding the effectiveness of gun-free zones. For the first study ever to explore gun-free zones, I looked at gun-free school zones. By federal law, 1,000 feet around all schools are gun-free. Violators face fines or prison time. Here's the article published in the Journal of Urban Health on the subject, titled "The Effect of Gun-Free School Zones on Crimes Committed with a Firearm in St. Louis, Missouri." As mentioned, one of the hardest things to accomplish with the study was coming up with comparison groups that were similar enough to the exposed units, the gun-free school zones. I had to pioneer study design that, to my knowledge, has never been used before, at least in gun violence research. I compared the area immediately around the gun-free school zones to the gun-free school zones themselves to see if there's a different rate of crimes committed with a firearm within the borders. Essentially, what I did is I counted the number of crimes committed with a firearm in the red area that you can see here, which is the gun-free school zones, with the blue area, an area around it that's in a reasonable comparison. These areas were also matched to account for differences in confounders. I then adjusted for differences in land area and include a measure of street length due to differences in geometry of the two areas. I did this twice. In the primary analysis, I used the true school grounds and then 1,000 feet from the borders of those school grounds. And while in the secondary analysis, I used just 1,000 feet from the address of the school. So you can see sort of the differences between those two. And this one, you see the actual borders of the school, while in the secondary analysis, it's just 1,000 feet from the actual geospatial centroid. As you can see here, in the primary analysis, we didn't find an association between gun-free school zones and crimes committed with a firearm. And this was okay, because a lot of people were saying that gun-free zones, including gun-free school zones, were actually attracting people to commit crimes. Again, they were saying that they were creating places where people were sitting ducks. So we did not find evidence of that. But in the secondary analysis, where we looked at some of the more proximal effects of the gun-free school zone, we did see that there were statistically significant fewer crimes committed with a firearm in gun-free school zones compared to similar areas immediately around the school zone. This again was the first ever published quantitative study evaluating the impact of gun-free school zones on crime. During my postdoc, I have taken this new spatial approach to studying gun violence that I learned and expanded it to gun-free bars and restaurants in Texas. I found that gun-free bars or restaurants have 48% fewer shootings within 50 meters of the centroid of their geospatial location, with a confidence interval ranging from 3% fewer to 61% fewer after accounting for alcohol revenue, nearby gun-free, gun-allowing establishments, and census tract demographics, including population density and percent of population aged 18 to 35. Interestingly, this is very similar to the gun-free school zones work, where the association becomes statistically insignificant when the buffer is expanded to 100 meters from the centroid, indicating the true proximal effects of the policy. This is also the first work ever done looking at the effect of gun-free bars and restaurants on shootings. You can see here that this is a map outside of Dallas, and the red dots are gun-free, while the blue ones are gun-allowing, and the black dots are shootings. But ultimately, even though mass shootings represent a very small fraction of the total number of gun deaths in the United States, that's often what the public cares about the most. So to be able to answer the question about the impact of gun-free zones on active shootings, I once again had to be inventive. I utilized a pair-matched case control study, where the cases were establishments where active shootings occurred, and the controls were randomly selected establishments where active shootings could have occurred but did not. These units were matched on time, establishment type, like bar, store, mall, office, or healthcare setting, and county in order to account for gun laws and norms. And just as a quick clarification, why active shootings and not mass shootings? You might have noticed that I switched my language a bit between the slides. So active shootings can be defined as incidents where a shooter or a pair of shooters purposely and indiscriminately shoots at individuals in a public place with an intention to kill. Importantly, no one has to be injured or killed for an event to count as an active shooting. Alternatively, most people consider a mass shooting to be an incident where 4 or more individuals are killed. For example, the subway attack in NYC a couple years ago would not count as a mass shooting, as nobody was killed, only injured, despite most of us likely considering it to be an important event to document and to understand. Furthermore, including only mass shootings would lead to biases. For example, let's assume, which is a big assumption, but that every time defensive gun use was present during an incident, they completely stopped the perpetrator from killing 4 people. Does that mean that a mass shooting never took place? And what if only 3 people were killed? That is the downside of using a definition that relies on the outcome of the event instead of the motive or event itself. Therefore, active shootings, which include all public mass shootings, was made the outcome of the study. You can see here in this big circle that crimes committed with a firearm amount for a lot of the different deaths from firearms. Active shootings are a larger circle, and while mass shootings are a smaller circle that kind of overlaps, because not all active shootings are necessarily also mass shootings, because some might not actually be public. I also want to state that this is an area of ongoing debate within the gun violence community. I am actually joining a committee soon to write basically an op-ed trying to finally put to rest what is a mass shooting, how we should be defining mass shootings or active shootings. Okay, but of course, active shootings were not all nice, ready in a database. To get an unbiased list of active shootings in the United States, I had to combine several different data sets, including the FBI active shooting database, Mother Jones mass shooting database, and the Secret Service's database of public attacks in public places, among others. And as I mentioned, exposure ascertainment was extremely difficult. It was the most difficult part of the study, and I needed to be as innovative as possible to be able to get the gun-free status of all of the cases and controls. I use the hierarchy here on the slide, and as you can see, it goes from local laws, posted company policy, media online reporting, visible signage on Google Maps, and then a phone call. A lot of the time I ended up on the phone with people. This was probably one of the most rewarding, somewhat exhausting, and interesting parts of my time as a student. I was yelled at, made a confidant by people. Sometimes I heard rather sad stories because I was actually calling at some points the places that had an active shooting, or people who answered the call. I'm also happy to speak more about these calls later if anybody is interested. Once all of the data was collected, I was able to actually do some statistics and found the conditional odds of an active shooting occurring in an establishment that was gun-free were 0.375 times the conditional odds of active shootings occurring in an establishment that was gun allowing, with a confidence ranging from 0.193 to 0.728. In other words, active shootings were 62.5% less likely to occur in a gun-free establishment than a gun-allowing establishment. This work has been under review at the Lancet Regional Americas for a long time now, and hopefully will be out very, very soon. So along with another paper that is about to be submitted that I've worked on my postdoc using a synthetic control approach, looking at the implementation of campus carry laws on violent crime happening on college campuses, I've taken what was once thought to be close to impossible in regards to studying gun-free zones and started to fill in major gaps. This work is literally the first quantitative work ever conducted on gun-free zones. And it was able to be done by being as creative as possible in study design, pioneering and adapting known strategies and methods to be able to fit new ideas and epidemiologic questions. As a note, my ability to be this adaptive in the study design was only made possible by my mentorship in this department. I also want to give a quick thank you before moving on to the Arnold Foundation, who funded much of this work. They really made this all possible. So moving on to the next section of this presentation. So this is all great and good, but what do we actually want to do in epidemiology? We hope that we're actually able to go and prevent harm in the real world. So we need to not only be pioneers in data and description, study design, but also in prevention. And all of these studies that I have worked on have all made it abundantly clear that firearm ownership and carrying in spaces results in higher rates of firearm violence. But while gun-free zones are one way to reduce firearm carrying, they are rather downstream, and they're pretty limited in their scope. This has inspired me to think critically about what can be done to prevent firearm ownership and carrying. Again, I hope thus far I've convinced you that firearm ownership or the availability of firearms is associated with more firearm violence, including mass shootings and school shootings, and that places where firearms are not allowed, such as gun-free zones, may have fewer firearm-related harms. For an extra push, you can also see here that countries and states with higher levels of firearm ownership also have higher levels of firearm-related deaths. I also purposely added on the bottom here quite a few citations on the slide to really drive home the idea that firearm ownership or availability is associated with firearm death. But what do we do about firearm ownership? Where can we intervene? As we know, we are not going to be taking firearms away from anybody. So what do we actually do? On this slide, you can see a stream with a hierarchy of interventions or major aspects of research that gun violence epidemiologists often focus on. Moving from the most upstream to downstream, we have social determinants, including structural racism, poverty, and education. Fairly still upstream, we also include early exposures to violence or crime, which can then lead to a desire to perhaps carry a firearm. As we go further downstream, gun violence epidemiology begins to focus more on laws regarding obtaining a firearm, including things like background checks, and policies on carrying and storing firearms like gun-free zones and gun access prevention laws, CAP laws. The most downstream interventions are laws criminalizing firearm use and medical interventions on victims of firearm violence. As public health professionals, we know that the best place to intercept on a disease or ailment is as upstream as possible. However, the majority of the research on the topic is below this line. I believe that we should be pioneering towards more upstream causes of firearm violence. Whoops. Sorry. To more upstream causes of firearm violence, including preventing ownership or carrying before it even happens. One variable that we know is a component cause, but not necessarily sufficient on its own to cause someone to seek out a firearm is fear. For example, several studies have found that fear of crime, victimization, and fear of an unsafe world are all associated with a higher risk of firearm ownership and carrying. We can also see this play out in the real world. For example, there were meaningful bumps in monthly firearm background checks after events that have made people feel less safe, including 9/11, the Sandy Hook mass shooting, the San Bernardino shooting, and the coronavirus pandemic. In fact, the majority of Americans state that they sought out firearm ownership now for self-defense, more so than for hunting or sport. Therefore, fear might be a logical place for an intervention to prevent firearm violence through preventing firearm ownership. However, the studies on fear and firearm ownership are among adults, and there can be some issues of reverse causation. Moreover, most gun owners say that once they own a firearm, they're not willing to, under any circumstances, give it up. And complicating this further is the fact that most people become firearm owners very early in life. Above shows a timeline for my K01 proposal, which I'm about to introduce, indicating some facts about firearms, including the mean age for first firearm ownership or purchase, which for males is only 19, and the mean age for first firearm purchase or ownership for females is 27. Therefore, if we were to create an intervention to reduce firearm ownership, it needs to begin early. The studies on fear and firearm ownership that take place when the majority of respondents either already own or likely will never own a firearm due to their own wants or needs are too late. We need to understand this relationship earlier in life to actually have a successful preventive effect. For that reason, I wanted to get to the root of a desire to own or carry a firearm, and that I wanted to do amongst adolescents. I therefore submitted the K01 proposal titled The Impact of Violence Exposure and Fear on Adolescent Attitudes Toward Firearms in California, a mixed method study to the CDC. I also want to quickly note here that this was only made possible to a bill that clarified that the Dickey Amendment does not block the use of federal funds for research on all types of firearm violence prevention work, finally in 2017. So this opened the door to funding that when I started, I didn't even know was necessarily available or would be possible in this field. The specific aims of the proposal are as follows. For aim 1, I wanted to describe primary and secondary exposures to violence among adolescents in California. For this aim, I intend to use a survey regularly administered at UC Davis through the Ipsos Knowledge Panel to describe the violence that adolescent respondents have not only personally experienced, but also have been exposed to through their community environments or social networks, stratified by sex, race, and socioeconomic status. For aim 2, I will determine if fear is associated with a proclivity to own or carry a firearm among adolescents, and how this association varies by exposures to violence, news consumption, sex, race, and socioeconomic status, using the same aforementioned survey from aim 1. Finally, aim 3, which I'm most excited about, will investigate the fears, attitudes, beliefs, identity, and experiences among adolescents and their desire to own or carry a firearm using focus groups. This aim is important because a survey alone will miss the many important nuances among adolescents and their attitudes towards firearms that could not be caught by a survey. Therefore, different focus groups based on proclivity to want to own or carry a firearm and prior exposures to violence will be formed to really explore the fear, attitudes, beliefs, identities, and experiences among these adolescents in California. Here is a conceptual model of how these 3 aims all work in concert to better understand adolescents' desire to own or carry a firearm in the future. All three of these aims, importantly, will be considered under the context of socioeconomic status, race, ethnicity, and sex. Given the varied experiences of people of color or those who are structurally disadvantaged due to decades of systemic racism and disinvestment in racially and economically segregated neighborhoods in the United States. In summary, this mixed methods research is set to uncover the ways in which past violence exposure, fear, racial identity, socioeconomic status converge to shape adolescents' firearms attitudes, and will provide a data-driven foundation for developing targeted interventions. These insights will be crucial for a subsequent R01, enabling us to design and implement interventions strategies that are precisely tailored to the needs of at-risk youth, and consequently reduce firearm-related harms. So very importantly, because I want this to make sure that this K01 has the most immediate and largest impact, I had collaborated with Nina Vinnick, the project of Project Unloaded. Project Unloaded's mission is to create a new cultural narrative that guns make us less safe, and this is all toward adolescents. They've agreed to help me edit some of the questions to be most appropriate for the age range 12 through 17 and supply feedback, and then use some of the results of this K01 once it has been published in their efforts to educate adolescents about the harms of firearms. And I hope this means that the work will do the greatest good in the greatest time. I'm also proud of this proposal because it is inherently upstream in the direction that I think gun violence epidemiology should be heading. Frankly, we are and always have been more than just policy analysis, descriptive work, or hospital interventionalists. We have the opportunity and responsibility to also intervene on some of the more fundamental causes of disease to prevent gun violence. This proposal also brings me a lot of joy because it's really returning to the root of why I wanted to do gun violence prevention work. I originally entered the field because I thought it was unfair that my students had to risk violence just to make it safely to school every day. I'm excited to be able to actually do research that can directly have an impact on their lives, as this K01 is the first step in a longer effort to create data-informed interventions to reduce firearm ownership, carrying, and therefore violence amongst adolescents and in their future. And in sum, the K01 presented before you today is more than academic. It is a commitment to pioneer prevention and change, to translate the findings into strategies that protect our most vulnerable, and to educate our communities about the true costs of firearm ownership. Let us remember our goal is not just to curb statistics, but to uplift lives, to replace fear with knowledge, and to secure a future where safety is not a privilege, but a right afforded to all. So to wrap up this presentation, gun violence is a major cause of death in the United States and the #1 cause of death for children and adolescents. Gun violence is also uniquely an American problem. Due to political pressures, gun violence prevention has been historically underfunded, leading to fewer gun violence-related trainees and published manuscripts than what would be expected for a leading cause of death. The lack of funding and research has led to a lack of data and resources, meaning that the work that has been done has been forced to be creative, and at times, gun violence epidemiologists have needed to pioneer new solutions to even the most basic questions. This creativity has resulted in pioneering in data and description, study design, and preventions. And recent changes in policy have meant that federal funding is becoming available for gun violence researchers for the first time in decades. Imagine the great work that can be done in this field once the ingenuity of gun violence epidemiologists and actual federal funding combines. And with that, I also want to say thank you to some of the OG pioneers in the gun violence prevention world. Many who pursued this career in research, even in times when funding was slim or non-existent. They truly made it possible for people like me in the field to do this work at all. True trailblazers, and we really owe so much to them. A special thank you to Dr. Wintermute, Dr. Kravitz-Wirtz, Dr. Pear, Dr. Rajan, and Nina Vinnick on their mentorship and consulting on my K01 proposal. And a special thank you to Dr. Brannis, Dr. Morrison, Dr. Rundle, Dr. Weeb, and Dr. Rajan again for their mentorship during my dissertation. Finally, thank you for the committee for having me here today. And thank you for the opportunity to discuss how my research and experience can intersect with the vibrant academic community at Columbia. I hope I have convinced you that gun violence epidemiologists are some of the most creative and badass researchers around. I also am excited about the potential to continue some collaborations and start new ones here at Columbia and participate in shaping the next generation of thought leaders in epidemiology. One of my greatest goals is to continue to mentor and help grow the gun violence prevention community so that there is no longer a lost generation. And with that, please let me know if you have any questions. Thank you.
So maybe we'll start with questions from the room and then move on to Zoom questions.
Yeah, for my capstone this year, I'm looking at gun violence as well, but I'm looking at it from the perspective of, has the NRA got a place, like what's their involvement in getting the crisis to where it is at the moment? On the assumption that, looking at them historically, their messaging to the community, the fear mongering, and very racial messaging, do you think that they're valid enough? I mean, at 6 million members and sliding, I know that their Midas touch is slipping, but it's still not going anywhere fast. So would you consider them a source of fear mongering, and then there should be some sort of like activities to counter what they're doing directly? If that makes sense?
Yeah, so the NRA is such kind of like an amorphous kind of group. There's like the leadership. Some of that leadership is in a lot of trouble right now, as some of you may know, like prison trouble. But also it's just a group of people that just kind of associate with the NRA and call themselves NRA members. So it is something that's pretty hard to study, depending on what you're looking at. But I will say that there is a history involved with the NRA. One thing that I think is really telling is that in the 1960s, when the Black Panthers used to carry firearms, the NRA was actually pretty promoting of gun violence, safety, and control, mostly because they have their motivations, which are perhaps linked to racism and structural racism in the United States. So there's definitely a history there. And I'm sure there's a literature on NRA and their effects, but I personally have not studied that exactly. But I'm happy to follow up with you if you want, and I can look into it a little bit for you.
Yeah. Thank you.
Ariana?
I'm curious to hear what you think how the Bruin decision will affect the current research of firearm epidemiology.
Oh, thank you for that question. So for people who don't know, the Supreme Court ruled in the Bruin decision that concealed carry is a right and that people have the right to carry a firearm outside the home. So this has a great impact on our work. And also because not only did it rule that people could carry a firearm, but that all other firearm research or laws needs to be under even greater scrutiny. For gun-free zones specifically in relation to this presentation, what happened now is that in response to the fact that everybody can perhaps carry a firearm, places like New York have created places that are gun-free. If you've noticed, like the Times Square now has a few blocks around it, like this is now a gun-free zone. So in response to the Bruin ruling, places are now making places gun-free. But of course, what that means is then there are laws or lawsuits and whatnot against these gun-free locations. So in terms of this work, it's even more important that we get out there that gun-free zones aren't making places less safe, that perhaps they're making them more safe. I also want to say, like in general, for the future, in terms of gun violence or gun carrying and gun ownership, if we are going to make a society where everybody is able to carry a firearm, perhaps we want to reduce the amount of people that are doing it. So that's also what I hope to accomplish in my K proposal. But yeah, great question. Christina?
Yes, to follow up, actually, you segue, but you started with gun permissiveness, ended with Project Unloaded. So then how do you, do your research epidemiologically address kind of the camp of that insists that ownership isn't the issue and moving research towards mental health, more like proximate individual level perspective or storage even, versus actually owning a firearm? How do you deal with that?
Yeah, so thank you for that question. So I actually wrote a chapter in a book about this, specifically about how firearm ownership relates causally to actual firearm violence. And if we think about causal pies, if people are familiar with the causal pie, we want to fill up a causal pie to become sufficient to produce the event. Firearm availability, having a firearm, is a necessary cause in every single one of those pies to produce firearm violence. It sounds sort of obvious to a lot of people, but we're almost afraid in gun violence epidemiology sometimes to call firearms a cause of firearm violence, despite it being so obvious. And that's perhaps because it's so hard to actually study because it's ubiquitous. It's literally part of every causal pie. And so different things like mental health are obviously also component causes in these causal pies. They play roles and they should also be intervened upon. But if we're really thinking about the way to make the greatest good in terms of firearm violence and preventing it, we should probably be going after something that's literally a necessary cause in every single causal pie. So thank you for that question.
One from Zoom, Carrie Keys has her hand raised.
Carrie, if you could unmute and ask your question.
Sure. Thanks so much, Paul. That was a great presentation. And I think my question is somewhat related, which is, how do you see your work fitting into firearm suicide epidemiology, especially with young people? There are more firearm suicides than firearm homicides. And I wanted to ask how you see your work fitting into the suicide epidemiology and what policies you think are the most promising to prevent suicides.
Thank you, Dr. Keys. Great question. So I think that in terms of firearm ownership and firearm carrying, that they're very much linked to firearm suicide as well. Again, like in a causal pie, the firearm has to be present for firearm suicide to occur. Of course, suicide can occur through different means, but what we know about suicide is that when a firearm is used, it's much more likely to result in a death. For example, while women are more likely to attempt suicide, men are more likely to actually die from suicide, and that's because they are more likely to use a firearm. So by reducing or educating about the actual harms of firearm ownership and carrying, that should also have an effect on firearm suicide as well. And for kids, this is even more important. Adolescents, kids are very emotional and can be very rash. And what we know about suicide is that it's often something that happens in the moment. If you're able to, even for a couple of seconds, even 30 seconds, slow down somebody from obtaining lethal means towards suicide, you can save that person's life. And with kids who are very much, can be irrational at certain points, this is even more important, I feel, than with adults.
And let's take another one from Zoom, Dr. Gualadi. Go ahead, just unmute yourself.
Hi, good morning. Hi. Paul, it's really impressive body of work. Congratulations. It's really amazing to watch you grow and accomplish so much within such a short time period. Your dissertation work, mostly unrelated publications, are mostly concentrated on the environment, or such as public establishment and policy environment. In the epidemiological triad, host, agent, and environment, I think it's very important to focus on the environment and the agent. So I was wondering, when you designed your K1 proposal, whether you could pay a little bit more attention to the firearms, the vector carrying the etiologic agent of intentional injury. I think there is so much more to do, and I know there is maybe a relatively large risk gap with regard to the properties, the characteristics of firearms. And unfortunately, as I said in the specific aims, are all related to the host, say adolescent attitudes, fear, and so on. And I know you're going to produce a lot of valuable information from the proposed project. But I feel you may miss such a great opportunity to focus on the firearms that may actually lead to some actionable knowledge and also practical prevention programs. That's just my comment.
Yes, so that's a great comment. So I completely agree. So when I was an infectious disease master's student, during my summer, I did a internship where I actually worked, I was the One Health coordinator for the infectious disease surveillance, something sad, I forget what it's called. But I totally agree in the environment, the host and the agent, and how those all are important. One thing about this study that I don't think that I didn't present just in terms of time is that it's part of this much larger study, which is CWAS, which is through UC Davis. So I would be in charge of the adolescent portion, which has never been done before, but there is an adult portion of this study. And the adolescents are really sort of nested within the adults. That's just kind of how this works with Ipsos. So we have a lot of information. We've already looked a lot about the guns in the home, a lot about what the parents' feelings are about firearms and whatnot. We already have that information, which then will also be like linked through for the adolescents to create more of like this environment. The agent is their gun already in the home and whatnot. So I hope that I will be able to address like the full environment to the host, to the agent within this proposal.
And maybe we have time for one more question. So.
Thanks for the presentation. Can you comment about whether there's a dose response? You know, it's homes with more guns or homes with guns that have more bullets and capability?
I do not know the research specifically on that. Definitely something I can look into. I will say what I find really interesting, at least in terms of the gun-free zones, is there does seem to be a dose response for the effect of gun-free zones as you move away from it. This perhaps makes sense, but at least as you get closer to the actual place that is gun-free, there seems to be a larger association than when you move further away. I would also suspect, just based off of studies based off of firearm availability, that if a firearm is very available and there's a lot of guns in the home in terms of firearm suicide or just being able to obtain the firearm to then use, that would lead to an increase in suicide or perhaps homicide and violence. However, I don't know off the top of my head the exact research for that.
Okay, well, I want to thank you so much, and I'm sure Paul will be back.